recording and welcome you guys to this ITAC webinar and ask Luz Collazo to welcome and open our topic today.
Thank you, Cheryl. Good afternoon and welcome to the webinar data collection. My name is Luz Collazo. I work for DC DD Council. The webinar is hosted by the Diversity, Inclusion, Culturally and Linguistic Competence and Equity Committee for ITAC. And today I am joined by my fellow committee members and TA staff to bring you information about sensitivity practices when collecting data. Presenters for today are Maria Pickleton from Georgia Council, Tindra Jackson from Michigan Council, Jackie Hayes from New York State Council, and Sherry Magni from ITAC. We invite you to introduce yourself and your name of your organization in using the chat box. I hope you enjoy the webinar. Sherry.
You're muted, Cheryl.
You're exactly right. Thank you, Tedra. So today we wanted to focus in on collecting demographic data. And just to remind councils, you guys collect this data to meet a regulatory requirement. And for all entities that receive federal dollars, you have some requirements, and it also is designed to help build a foundation for monitoring racial and ethnic disparities. And of course, we use the data, councils use the data to help us understand causes of disparities and really then to monitor disparities over time. And so one of the other major reasons that we collect our demographic information for OIDD is to really demonstrate how we are reaching people from different groups, racial groups, ethnic groups, gender groups, geographic areas, as well as really being able to show the number of people with IDD and family members as well. I believe I'm going back to Luz.
Yes, thank you, Cheryl. So as you know, ITAC received a lot of questions. Why does gender only reflect male, female, or other? Or the categories on race and ethnicity in the PPR does not reflect the race and ethnicity of the people who participate in our activities? Can we require people give us the information? Can council staff, our grants, can observe participant giving the answer of any survey? So, Maria, go ahead.
Thank you, Luz. My name is Maria Pinkleton. I am with the Georgia Council on Developmental Disabilities. And just to give you a visual description, I am an African-American female wearing a cream sweater, and I have curly hair and glasses. And I'm going to talk to you about some other concerns that council staff have reported when it comes to obtaining this demographic information. They have noted that some of the response options are not sensitive, mainly in the areas of male, female, or other for gender. The actions of asking for demographic information can be offensive to certain cultures. Immigrant population members might not want to report their information because they fear they might lose services. And then also some people from other cultures may not self-identify as having a disability because that possibly is due to different cultural views when it comes to disability. So I'm going to pass it back to Cheryl now.
So just to remind you guys, what data do DD councils collect and report? And as you know, you've just done this in not one, but two dazzling PPR reports. You collected demographic information for your council funded or sponsored activities. You collect demographic information for your council member rosters, as well as staff member rosters. And So there are, remember, the reason we have to collect this and the reason the questions are what they are is because the Office of Management and Budget, which is OMB, has minimum standards, and they have all federally funded federal agencies, and then anyone receiving money through those federal agencies collect the same data. So there are categories for ethnicity you can see here on the screen, which is Hispanic or Latino, not Hispanic or Latino. Categories for race are pretty narrow. American Indian or Alaska Native, Asian, Black or African American, Native Hawaiian or Pacific Islander, and white. And those are the minimum standards. And then we have our PPR required data, minimum standards again. Gender appears as male, female, or other. Category of participant is individual with DD, developmental disabilities, or family member, and then urban or rural, and that would be tied to either the council member who lives in one of those areas or a participant. And so these are the minimums. However, councils are you're encouraged to collect more specific information using categories that then can be rolled up or aggregated back to the minimum categories. So today our intention is to show you guys some ways to do that is more respectful and more sensitive to the people living in your state or territory. So I am, I don't, I think I'm going back to Maria. Would that be correct, Maria?
I do believe so. We first want to look at what we are doing when it comes to, sorry, I'm moving people's faces out of my way. When it comes to asking the questions of the demographics group. And the first thing we want to do is ask for help. And most councils do this by review. So we are asking that you ask people from a wide range of demographic groups to help you develop your questions or review your questions. You can ask members of your council. You can ask members who participate in your various funded programs. Things you want to consider are paying attention to feedback from groups that have been historically marginalized. Also, you would want to troubleshoot for solutions that address all of the concerns, even when that feedback that they are giving you may seem contradictory. Next slide, please. Number 2, explain yourself. Tell people exactly why you are collecting the information. I think we all get a little bit nervous when people ask some details of us and you're like, why do you want to know this? And we all know that we want to know this primarily for our grant reporting, PPR, as well as when we collect this data, this helps us see inequities across our projects and our activities where we're falling short in the state as it compares to what the actual population of our states are. Tell people what you will do with the information and who's going to see it. Be transparent, be open and honest with them because their concerns are valid concerns. Tell them if you're going to share their information with other organizations or companies, and then share the details about your privacy policy if you have one. And finally, tell them when it will be made available for others to see. So if there are possibly any follow-up questions, they can be prepared to receive those and answer those. And you may want to consider providing an explanation next to each demographic question so people know exactly what the questions are asking them. Next slide, please. Number 3, make multiple selections possible rather than limiting your users to one choice. So what this means is because most people's identities cannot be summed up by one category, you really want to provide multiple options, and that's the best way to accurately capture the demographic information you need. Plus, it allows users to identify in the ways that best represent them. I'm now going to pass it over to Tedra.
Thanks, Maria. So the next best practice is to leave a blank box at the end of every demographic question. This is really you allowing people to write in whatever they feel best reflects them. Because some of the categories, the required categories, may not align with what people identify themselves as. And be sure to track the responses users type in. And if you notice something that's recurring, a lot of people identify themselves in one way that you do not have on your survey or on whatever tool you're using, then you can modify your form to add that category so that people really feel like they're a part of your activities or whatever it is that you're doing. It would really just help to validate them as participants. Next slide, please. The other thing you want to do is re-examine the order of options you present in each category. So typically, because we're in a male-dominated world, we always start with whatever the dominant characteristic is. Typically, we list some stuff in order of hierarchy. Usually, male comes before female, and then other or non-binary. So you want to just look at, even though we know that stuff isn't really listed in order of importance, sometimes when people are reading or interacting with a survey or any list, human nature tells us that the number one thing on the list is the number one thing to pay attention to. So one possible solution is to categorize or to alphabetize all the categories, or to just, you could mix it up any way that you want to, but just try to not always have that dominant cultural characteristic be the first thing on every list. Next slide, please. So you want to use data collection and analysis methods that are culturally sensitive. So that means that, as Cheryl alluded to in the beginning, it might be offensive for some cultures for people to ask their birthday or their age or their ethnicity, and people might not want to give you that information up front. So one of the things that you want to consider is, when do you get that information from people? Do you get it in the middle, once you've known them for a little bit, once you've built a trusted relationship? Do you get it at the end? Say you're doing a series of trainings or other events, and the same people are going to be coming, month after month, after they have had some time with you or with your grantee, and the project is going to wrap. It might be that with your end survey, then you ask people for their demographic information, and they might feel better about giving it to you because they know you, they trust you, they trust that you're not going to do anything untoward with their information. So you want to look at how you can be culturally sensitive when you're collecting data. And also you want to look at maybe contracting or partnering with another organization that has that's more familiar to that community, or more familiar to the people that are in that community, and maybe contracting with them to collect the demographic data for you. When you're dealing with information of data, especially demographic data, that is usually the most personal data about someone, that's who they are or how they see themselves. Most people hold really tight to that. And so you want to make sure that there's a trust relationship there before you start asking people before you just start asking people for information, before they know you, before they know anything about you, you know, consider, do you really need that, all of the demographic information when people are registering for your event? You know, it might be that maybe at the end of the event, if it's a one-day thing, that's a better time. So it's a conversation that should happen, especially when we're in new communities, working with new people that are part of new, or that are members of cultures or other communities that our councils aren't typically working with. So I'm going to throw it back to Cheryl.
So we just reviewed 5 best practices for collecting sensitive ways to collect information. Now we want to show you some ideas and examples practices would look like as you guys are pushing out some data collection instruments. And one of the things, of course, because Congress appropriates your money to Health and Human Services, which is HHS, they do have guidance for ethnicity and race questions. They do recognize and tell us that self-identification is the preferred way to get the information unless you need to observer identification is more practical. Again, that needs to be explored with the community you're trying to gather the information from. They also felt they have a number of things in a document, and the link to the document is in this presentation is already posted to the website. So if you wanted to see the link, but they're saying, you know, multiracial is not a category. That is why you want to give as many options with a self-identification approach so that you're not making assumptions that are not true. And of course, again, they do promote you guys gathering more specific data as long as it is, you know, you can aggregate it back to a standard set of categories, and we'll show you what that means in just a little bit. And then this is outside of the HHS guidance, but some information on evidence-based practice information from the Census Bureau suggested just using a general approach when you collect information about ethnicity and race, and just ask people what categories best describe you. So I'm going to throw it over to Jackie, and she's going to show us what that would look like.
Great, thanks so much, Cheryl. Again, this is Jackie Hayes. I'm the Diversity and Inclusion Program Specialist at the New York DD Council. And so, as Cheryl mentioned, this is a really concrete example of one way to collect racial or ethnic demographic data. And really, it's about, you know, rather than using the global categories provided, you can kind of spell out very specific racial and ethnic identities next to those larger categories in order to be more inclusive to your state or region and the communities that are in that state and region. So for example, in New York State, we have a very large and diverse Asian American, Middle Eastern community in our state. You know, we have the largest Bangladeshi community among states, the largest Ukrainian, the third highest Afghani population. And so it's really important for us when we're thinking about where we're going, you know, what are the demographics of that region or area. And we've definitely had grantees reach out to us too and say, hey, the people that we're serving aren't reflected here. How do we do that? And so this is exactly, you know, the technical assistance that we provide to our, you know, our grantees as well, to say, yeah, definitely include any, you know, any group that you think is important to include. And as Cheryl said, you can just kind of, when you're taking the data back, you know, pull that into whatever format needs to be reported for the PPR. And so, yeah, I think next slide. And so in terms of, gender questions, it's very similar to race, collecting racial and ethnic data. It's really important to be first, have an awareness of where you're going, who you're collecting this information from, and really wanting to be as inclusive as possible. We did, one of the trainings that we went to around LGBTQ awareness and pride in creating safe spaces, they really said one important thing is people being able to see their identity reflected in things like demographic questions. That's really important. And so here's an example that was taken from Catherine McLaughlin. She does the sexuality training that many people are aware of. We also have a grant with Catherine and Elevatus for them to do, sexuality and gender identity and health trainings in our state. And so these are some recommendations, and, have female, male, non-binary, which can encompass, gender queer, gender non-conforming, transgender, prefer not to say, and self-identify. I'd also just add here too that I think it's really important for council staff to be aware of these terms and know the distinctions, so that when people ask questions, that you know how to answer them. And, because definitely there's been cases where people are like, I don't know what this means, what this term means. And I think it's so important that we lead by example and really are aware of these terms as they're evolving and changing, and can explain and go into detail and, in plain language or in other ways. And so, yeah, I think next I'm going to pass it back to Luz.
Thank you, Jackie.
Yeah.
Thank you. Yes. Recommendation related for where the people live. We recommended like a short question, like where do you live, followed by a big city, a medium city, a small rural area. Some other area is please specify zip code. Some council use the USDA rural urban continuum code that classify between urban, rural, big or small country, cities. In the case, so you may need to reflect the language of the preference of your organization. In this case, in DC, we use the resident live in wards, so we use that. Or people will say will not live in the district. I don't know is other option that we gave for the survey. Also, I prefer not to answer. So this is some of the sample for the question, where do you live? Next, please. I would like to share with you 2 examples related to disability data. We say, please answer the following question. Your answer will help make sure we are reaching broader group. The question say, I am. So select the answer that best describe you. As you see here, is more open, not only for disability person or person with developmental disability, also give you the opportunity that they can choose person with mental health disability, family or caregiver of a person with disability, professional or of an agency or organization working on disability issue, community representative or advocate. I prefer not to answer other. Next, please. Also, if we want to have more information related to the condition, so here's the question, what is you or your family member disability? So here you can open any option. So it can be intellectual disability, cerebral palsy, autism spectrum disorder, deaf, blind, or hard of hearing, multi-disability, more than one, mental or emotional, physical, self-identify, or I prefer not to answer. Again, we open here a blank space so the person can decide what they want to share here. Thanks. Who is this? Tendra, please, come on.
Thanks, Luz. So just a couple more things that you want to consider. We talked about on my other slide, trust, and making sure that you have trust, you build trust, especially if you're in a new community. And we got a couple comments in the chat. We got a comment about asking for the information at the end. So during the Q&A, we will definitely open up a discussion about that. And the other thing is that if people don't want to give information, we need to report that. Just like that. We asked, we had 100 people there, 20 people didn't want to give us the information. If people don't want to provide information about race or ethnicity, we're supposed to report it as race unknown. If they choose not to answer. And even though we don't have a race unknown category that we report specifically for the PPR, in our comprehensive review and analysis, when we are, in somewhere in our narrative, we should be reporting like the number of people that were race unknown, so that it doesn't look like we didn't make a good faith effort to collect the information. And Cheryl is going to talk to us now about using our data.
So thanks, Tedra. So now that you've collected this data, you might need to do some work to transfer the data that you and your grantees have collected to transfer it over to the PPR. I'm going to pop up a quick little collector poll just to kind of see where you guys are, who's collecting data for you while we go through these slides. So you guys know what the PPR categories are. They are listed. I have met with OIDD and said, hey, can we get a reordering of list? Maybe make this alphabetical. And so they're very receptive to it. But these categories you would find if you went over to the HHS Office of Minority Health, it would look very similar. All of these categories meet the OMB, Office of Management and Budget, minimum standards. And so you'll see here, and I did pull this directly from the HHS Office of Minority Health. You're going to be rolling up, if you guys choose to do something that really a survey that represents the heritage of people living in your areas, then you would be able to roll up to a category that meets OMB standard. And so you'll see here, these are the categories. You have the Asian category. You have a number of races, ethnicities that do roll up there, and then your Native and Hawaiian or other Pacific Islander, another category. So you might have to manipulate the data, but in the spirit of really having a sensitive survey, I think that this is, again, a demonstration that the council can really show that you are using culturally sensitive ways to adequately and accurately reflect what you're collecting. Same thing for your ethnicity data standard. If you are using a question and you're asking people to select one or more, no, you're not of Hispanic, Latino, or Spanish origin. Yes, I'm of these. Yes, yes. All of these then would roll up to the standard category that meets the ethnicity standard. So really how you design your surveys may indeed create a kind of a rolling up, what I think the HHS policy calls it. Would be granular data that then gets aggregated to the minimum standards. So we did want to kind of also bring you some information about some, we talked, I think the second, one of the best practices, maybe number 2, was explain yourself. And so we wanted to bring you some information about statements, how you can, provide some statements that explain why you're collecting data, and what you're going to do with it. So I'm going to ask Jackie to share some information with us.
Great. Thanks so much, Cheryl. So yeah, we found it to be really important, like you said, to kind of explain to anyone who's collecting demographic data, whether it be our grantees, on our behalf, or if it's council staff, really kind of providing some information about, that kind of like background about why why you need this information, and try to get some buy-in, I think, on the front end. So, this is an example of what would be included on like every survey statement, to say we use the information that you're providing to make sure that we're reaching the, diversity, or the people from different racial and ethnic groups in our state. We use that information to help the council develop and make programs and activities for people with developmental disabilities stronger. We do not collect your name, address, or phone number. And so when we have kind of like in-person one-on-one conversations, we'll say that we de-identify your information. So none of it is tied to your personal information. And it really is more about us being able to look at and see, are we reaching and serving the diversity of our state? So we try to create some buy-in in that way, with that set of, that idea and that set of ideals. Go on to the next slide. So we created a TA document for our grantees in 2016 at the beginning, where we basically would give it to our grantees so that they could, very exact language. All they would have to do is take that language and put it on surveys. And we really wanted to provide that concrete example to make it as easy as possible for our grantees to do this. So we have that example statement, and then also the statement of purpose. And I will say that, through our TA efforts, when we started collecting demographic data, we saw that in 2017, less than half of our grantees were collecting demographic data. By 2019, close to 90% of our grantees were collecting demographic data. So by providing this TA resource and a lot of like hands-on support, we really did improve, it helped to improve demographic data collection with our grantees. Great. And then I think I turn it to maybe back to Cheryl for this slide. Sorry if I got that wrong.
We can do that. I am going to put a poll up about how you're using the data. We want to have some ongoing discussions with you guys about, some ways that we can really help expand our knowledge through each other. How really are you using the demographic data? And this is an anonymous poll, by the way, and so was the last one. So you're not disclosing anything. It is anonymous. Some councils just collect it for PPR, but then we know that there are other benefits for really looking at the data and then determining how that can enhance some of your projects and activities work of your state plan. So we do want to have a continuation conversation, and we have planned something for June so that we can again talk about your assessment of data, how has that led to meaningful changes, and how your efforts are implemented. What are some ways to look at that data to determine how meaningful changes could be made. And then at the your grantee level data, again, it's so good to hear that, the New York State Council's experience, where they've really been able to measure the increase in the number of projects that are collecting demographic data. But now we need to really move into, now that you're collecting the data, what are you learning from it? And so I think those are the kinds of topics that we really want to talk about in June. So more to come on that. Believe final thoughts are coming before we have some time for questions and answers. So Maria?
Thank you, Cheryl. So yes, final thoughts for today's presentation and discussion. We ask that you routinely evaluate your demographic questions to make sure they do not include outdated or inappropriate terms. As we all know, times are constantly changing, language is changing, terminology is changing in the disability community, in the community on this planet, right? So you always want to make sure that the questions that you're asking are appropriately stated and phrased. If you have questions, I am sure there is an ITAC form or document that will be made available, right? That will always help you. Or if you have questions, just ask dear old Cheryl what you need to do to make sure that your questions that you're asking are the most appropriate and up to date. We also want you to review your collections to determine if your questions are brief and relevant and have meaningful use. If you're asking questions of your audience that you're not really using in PPR and you're not really using it in any of your other reporting, or using it to inform what you do, what direction your state plan takes, you can consider removing that. We want the questions period of their experience with your council to be as brief and pleasant as possible, and no one likes a long survey. Also, annually review your questions to see if any revisions need to be made. Possibly there are new communities, new populations of people that are in different demographics than you have included on your forms. And so you will want to revise those to really reflect the population of the people that are in your community. And with that, I believe I am passing it back over to Tedra.
That's not what I want to do. Thank you so much. So I have been collecting the information. We had some good questions and comments in the chat. Cheryl, do you want to? Yeah, okay. That's good. So we can just see everybody and really have a good conversation. So one of the first questions or comments that we got was that when we collect information at the end, we tend to get far fewer responses, which means our performance measures 1.1 and 1.2 are artificially low. So I think one of the things that you can do for that is 1.1 and 1.2 are really about, are you a family member or a person with a disability? So maybe that's information that you want to collect in your registration. You know, people aren't usually, depending on who it is, there are some cultures that might not want to self-identify, or they don't self-identify just because of cultural factors, but potentially ask the who are you questions, family member, person with a disability or other, ask that on your registration, and maybe ask some of the other questions at the end. You know, so that's one.
When you say other questions, the other questions on gender, race,
yes,
ethnicity.
Mm-hmm.
Okay.
You know, you could do like your demographic information, like about where they live. Is it rural or urban? Which a lot of people in Michigan, most of Michigan is really rural, but we have some big cities that like 3 or 4 counties make up most of the population in our state. And so, but you'll get people that live in smaller areas that will say that it's, you know, it's an urban area because it's like the county seat for the really rural county that they live in. So that's where that slide that Lou shared that had you live in a big city with some examples, which were all from Alabama. Troy, Alabama is where Cheryl lives, just in case anybody was wondering, which is a small rural city. And so it's really based on where you are in your state, like what state you're in and like who your grantees are. It's why it's good to have a conversation. So like we're prepping in Michigan, we'll be having a grantee orientation soon, and we'll plan to open this up. We've talked about it before, but we'll continue to do that. We had another really good question from Yasmina Barawi from the Michigan Council, who I've never heard of before. No. And I wanted to just check and see if Cheryl's slides that talked about how to roll people in to the categories, was that helpful?
It was helpful, but it didn't answer my question.
Oh, okay, well.
Because for those particular categories, you know, you can't assume any particular race.
So in the PowerPoint presentation, there is a link to the Census Bureau's definitions of their racial definition, and that should help. It should help. I'm not saying it will.
That's a good question. So the categories that she actually asked about weren't one of our examples, which was Middle Eastern, Northern African. And so it's
but they were on the example. They were on the example that New York gave, right? New York had a nice range of identifiers, and then they had Middle East, North African, Egyptian, Syrian, whatever. But when we talk about roll up, if you give people an option, and then, you know, how do you roll that up?
So I think you guys want to go back to the U.S. Census Bureau. They actually categorize it pretty well, but it's very extensive. Can't fit it on one slide. Sorry about that. So I would look at that as you guys are building out your granular survey, you know, just double check that it kind of rolls up and supports because basically the federal government is driving where people report certain, you know, all the specific data. So you're just trying to then just put it in a box. Now, you know, I've had lots of spirited discussions with folks. They don't like the way certain, you know, like Middle Eastern, they don't like the roll up on that. But right now, it's the government that makes those determinations, and that has not changed. And my information, this race definition stuff is current. It's 2020. So it's not like it's from 2000. It's, you know, it is what is currently being used. And I don't know that I saw some comments about, you know, some potential changes, but I do not believe that has been adopted by the government yet. I couldn't find any confirmation of that.
And Luz just put she put that link to the census information on race in the chat. So if people want to go ahead, if you want to go ahead and check that out. I think the other thing that just really makes sure we make clear is that the council staff does the roll up.
Yes.
The roll up doesn't happen in the community. And so people, you know, we don't want, the council staff does the roll up. We'll leave it right there. Someone else said it would be good to have a specific transgender male or female category. Some transgender people do not consider themselves non-binary and might have changed their legal gender and wouldn't feel they have a category that fits in the prior example. I think that's up to our own, like each council's discretion.
Definitely.
We could, you know, that's why we suggested one of the best practices is to always leave an open, you know, to always leave a text box for people to be able to put their information and identify themselves. But again, these are questions that there would be nothing wrong with that, except for you would need to roll that up, because when we report to the PPR, there's not a box for transgender male or transgender female. So just remember that. The other thing, the next question that we got in the chat, Cheryl, is it okay for us to report disability unknown? So we got a comment that said, I understand reporting unknown for race, gender, et cetera, but we can't do that for disability status, unfortunately. So would they just be excluded from our performance measures? And that goes along with the question that we got about people that we know fit our definition of disability, but don't self-identify as people with disabilities.
Right.
So are
So
we able to report that disability is unknown?
let's see. So I'm trying to go back in my mind. Do not wish to answer is definitely for the council staff roster. You don't have to disclose disability. So if we're not talking about that roster, council members would have to identify as a person with with an IDD as a self-advocate, and families would have to say, there would have to be a determination that they are a parent or an immediate family member. But those are because you're meeting other regulatory requirements. So that's a higher standard. Now, if we're talking about participants in activities, which I think is where we're talking about, you only have two categories that you're reporting. It's a person with intellectual and developmental disabilities or a family member of a person with intellectual developmental disabilities. I do not believe there is a category that is like on the form. There's not yet another category doesn't want to disclose. However, the fact that somebody doesn't want to disclose is still valuable information. So you would want to reflect that in your PPR under your evaluation results. If you're finding that people don't want to disclose or answer the question, if you had 100 participants and people, half of them did not want to tell you, that is information that is valuable. But I think it's also important to note that the HHS guidelines, while they highly recommend self-identification, they also support observer information if that is a more practical, if that is a more practical way, and it produces reliable and valid information. I mean, you should not, people shouldn't be guessing. I think there would have to be some protocol there. So I think maybe looking at the HHS guidelines, if you wanted to do observer, people noting that down.
So Cheryl, that segues us into a really good question that Nia asked in the chat earlier. She stated that we had one grantee strongly resist asking any demographic information because it would deter their population from participating. Do we have any tips for working with grantees in this case? And are there instances in which it's okay not to ask for demographic information? So I would say that it is not okay for our grantees not to ask the information. They need to ask the information. However, just as in any research or survey that you're doing, if people decline, then it's their right to decline. I'm gonna go to Cheryl. She's nodding her head. I feel like I answered it right, but Jackie unmuted and Cheryl. So let's see. Let's poll the crowd.
I have maybe an example to share with from New York. So we have a grant with the Office for New Americans. They do outreach to a number of immigrant communities, which include people who are undocumented and really fearful of sharing any personal identifying information because they, for understandable reasons. And so we really sat down with ONA at the beginning of the grant to say, when are we going to collect information? Where are we going to collect information to try to really get at grant impact, but in a way that still is, culturally responsive. And so I think, what we had worked out was some of what they were doing was training ONA staff on better working with people with disabilities in their community. ONA staff are fine with feel comfortable with reporting demographic data, having forums, large forums, whether it's like Zoom or WebEx, where it seems a lot more de-identified. You know, people were pretty comfortable in those type of settings, sharing demographic data. So we really just had to say, we need a special session with you to work with you on at what points. And I think, you know, to the points that I think, you know, Tedra, you made earlier about really being thoughtful about, do we need this information? At what point do we need the information? And things like that, like thinking about that with the grantee and working with them to like adapt in a way that makes sense.
Yeah,
The
and
threat
Tedra,
of
yeah, you're right, Tedra. It's not okay to just bypass and say, you know, your grantees are recipients, they're sub-recipients of federal funds. This
Mhm.
is part of the this is part of your responsibilities, and because you're receiving these federal dollars. So I think a lot of times it almost might, I think we have to go to the beginning. Do they know why they need to collect the information? I mean, who can't get on board with, we want to see, or we want to try to reduce inequities? I mean, you know, people just need to understand why they're doing something. So I agree with all of the subject matter experts, because it's not okay not to ask, but I think it is very telling about maybe they need some technical assistance from you as council staff to really help them understand what they need to ask and ways to do it that is respectful. And then, you know, what are they asking too much? Are they asking for information, as Maria said earlier? I mean, is it nosy or do you need it? You know, I mean, basically, because you and I fill out surveys all the time, and I'm like, I'm not going to tell you that, you know. But why do you need it? You know, if somebody asks you a personal question, why do you need it? So I think being able to tell people why we need the information and really state very clearly, this is stuff is not tied to your name, your, you know, your address, your phone number, that kind of thing. Tedra?
The only other thing I would add to the conversation, just about people disclosing information, at some point in time, you do have to, the law requires that people identify with us and with the mission of the council. And so we try not to, in the communities, we don't tell people we're sending your information to the federal government. Like, people know that they're getting the information and the council's going to use it. And, you know, we don't try to scare people. We give people like that, the information kind of that they need. Our grantees understand that, but people, you just have to kind of figure out how to get the minimum amount of information that you need. So if you know you're working in an immigrant community where there might be undocumented people, when you report it back, if people didn't answer the questions, you would say, you know, we worked with X community, there were 30 people, this is a large Latin American community. So you just would have to kind of describe it, because we are still responsible for the dollars that we put out into the community. And so we have to get creative.
Yeah, one of the things that you're asking, like your second question, the grantee who's resisting asking because it would deter, that goes back to Tedra's point about timing. Timing is everything. In order to gain access, you know, so you don't want to be perceived as, in order to gain access to the information that a family or a person needs, you got to disclose all this stuff, you know, your personal information. So maybe it really is about talking with people about timing. What about a trusted intermediary? I think it probably goes back to the ask for help. What do members of that community find offensive about this, you know, or it scares them about it. So I think that's where, you know, really having the conversation, not just with your grantee, but can the grantee bring some actual participants forward to say, help us? You know, I need you to help me figure out how we can really demonstrate, you know, collect some stuff so that we know we're reaching a wide group of people.
We have two more questions that are really more more direct, you know, Cheryl. So one is, say 20 people attend an event, 10 people complete a survey, but 2 of those 10 left the race boxes unchecked or didn't select anything about race. Do you report 2 race unknown because that's 10 people completed the survey, or do you report 12 race unknown because 12 people not only didn't complete the survey, 10 people didn't complete the survey, but these 2 left
Gotcha.
a space blank?
Okay, so then the question goes back to how many people are, so you're reporting 20 people, 20, you're reporting 20 participated in the council funded activity, but only half of them completed a survey. And so I'm going to have to ask the feds. The feds, OIDD just indicated that we should be looking at the race unknown, or yeah, race unknown. If someone who completed your demographics, someone would actually have to give you the demographics to be able to answer, like if they filled out gender, but they didn't fill out race, then it would be the number of people who filled out this survey.
Thanks, Cheryl. And the other question, okay, someone says, I like the idea to ask some demographics at one time during a project and some others at a different time, but that will result in different numbers. And would that skew your results? Yes, it might, but not if you track it well. I mean, it would likely to result in a little bit more work for your grantees. So if you collected some information in your registration, but then at the end you save the race and gender, which we've got a hot topic going on gender, Cheryl, in the chat. And I think that's a problem that we'll go to that one next. So you would really kind of have to figure out, okay, so we know this many people registered and answered these questions. If you're seeing those same people over time, it would be probably easier to track it back versus if it's a one-shot deal, if people are just coming for the day. If people are just coming for the day, you probably have to ask all of your questions either at the beginning or your ending survey in order to match them up. But also, I don't know for me personally, but we're going to go to Cheryl on this one, if the same person has to answer all the questions. Like, it's not necessarily a one-to-one, because when we do our data, we aggregate it all anyway. So we're not really tracking for the feds that this one person did these 10 things. We're tracking that these 2,000 people did these 30 things that all of these different people did in the community.
Yeah, I believe your demographic is reported by goal. Mm-hmm. Is that correct? So it would be all of your objectives underneath, all of the objectives with corresponding activities underneath the goal is what is being reported to OIDD.
And we have a big problem. I'm sure most people have this, but like probably about 4 or 5 years ago, I made a call to Sarah when we were doing our PPR, because we had a lot of people, say we had 50 people go to an event, we might get 12 surveys. So if we are reporting on the 50 and not on the 12, it would make it seem like your number, like you weren't really doing anything. So she instructed us to report on the data that you have. So data that you don't have, you can't count.
Right. It goes back to that respondent thing that Molly
Mhm.
was mentioning, but the respondent information, so this is demographic. So demographic is all, you know, kind of combined together by goal. And so it's not really, they're not pulling it out unless you pull it out and reporting it in your PPR that for a specific housing project, you had these discrete, you know, racial and ethnic represented groups involved. I mean, and you guys may want to do that, but for the feds, they're looking at overall your goal stuff. So I think when we talk about the respondents, what we are trying to get at is you know, we don't want it to be a skewed result like I had 50 people but only 10 participated. You want the results, those outcomes of people being able to better speak for themselves, you want that represented on the people who answered your survey rather than the total number of participants, because you know, we can't punish. Our view was we can't punish councils because someone doesn't fill out a survey. This is not a conditional thing. You know, people can come to your stuff, it's not conditional on them giving you a survey answer. So it's a very interesting, it is interesting. You're trying to do the best you can to prove your outcomes, but you also can't force what will not be done.
So it is 4:33. And so we want to honor that, and we understand if people have to drop off. But I would want us, if possible, Cheryl, to, even if we can't have a full conversation on the gender question that happened in the chat.
Yeah, and so you know, I'm going to be honest with you guys. We had this very spirited conversation back in 2014 and 15, to the point where some of the work group members who were trying to figure out, why do we need to even ask about gender? Why is that important? Why does the federal government need to know that? Well, because it's a regulation. I mean, bottom line, they want to know about, and their OMB minimum standard, so let's be clear, is they want to know female, male, and as offensive as it is, other. That is the category. Now, how you collect that and how detailed you want to get with representing all of the different terms. You know, I've struggled with non-binary, trying to really get a very clear explanation of what that means, so that if somebody's looking at your survey, they would know what are you asking. So that was difficult, because then you bring in all of the other terms that continue to evolve. And so I think it is a very personal question. You know, I don't see many of you putting, you know, things like heterosexual on your surveys. So, you know, you guys have to determine what is best. Do you want a discrete thing? Do you want to match the minimum standards with female, male? Determine what you want to include. You could simply put self-identify as the third category, so that you're not. But I know people like to have, you know, see their own identity listed. It comes down to a matter of practicality. If someone with intellectual or other developmental disabilities picks up your form, how are you going to then provide an easy to understand explanation next to each one of your items? That's part of our challenge as councils. We have to really think about the plain language. And again, is that information going to yield specific information to help you track and reduce those disparities over time. Perhaps that needs to be, again, probably reaching out to some folks in your communities or in your states from those communities. What is most respectful? What is most sensitive? So I know that people get very, you know, it is a highly spirited conversation. Lanny, you have your hand up. Did you want to offer something on this?
Yes, so I guess my question is really, it looks like if we're taking the OMH definition, it looks like it's asking sex, not gender. And they're two slightly different things. So that's why I'm wondering, like, I get if we said sex and then we said male, female, but gender is usually a woman, a man, and slash a man. And I've definitely been in some culturally responsive evaluator meetings up here in Alaska, and they talk really about the importance of wording. And there's kind of a difference between male and a man. And so, like, just kind of wondering why we're asking gender instead of sex, if that makes sense.
I got you. Absolutely.
The PPR asks for gender.
It does, and then lists.
Yeah, it lists male, female, other. It doesn't ask for sex.
Yeah, and so that's where I'm saying, where are we getting this from? Because when I was looking at the OMH like categories, it specifically says sex, not gender, and lists male, female, or
it
male,
came
female.
off the. Tedra's right. It came off the PPR.
Yeah, and so I guess where are we getting the PPR? Where is that question coming from? Because it's just like a slight disconnect, I guess.
Yeah.
And yeah, especially coming from a lot of people up here that in the evaluation world, that there's a lot of people in the LGBTQIA plus community, and they're like really specific about, you know, there's a difference between a man and male, like, because one is at birth, which would be sex, male, female, and then gender is the identity. So and actually on the surveys we've done, and just to get around it, we put sex/gender and then prefer to self-describe as well, so that we kind of cover our bases, because the wording is really, I don't know, it's like kind of misleading, and I feel like we're asking a slightly different question.
No, that's
if we're asking gender
point.
versus sex.
Yeah, and I just need to take that back to OIDD. Honestly, when that document was created back in, I think they really created it back in 2014 for clearance from the Office of Management and Budget. You know, we've evolved, and you know, we have the opportunity now to kind of say we probably need to change that wording. So
okay, I was just like, every time I see it, it kind of like it. Just having people that have told me that, you know, wording really counts, like for representation, and, you know, like people are saying, you know, if they don't see how they identify, some people have been like, well, we won't even answer the questions, you know, the rest of the survey, if like the questions aren't really, you know, like aren't geared toward them, and they don't feel like they can answer how they would like to. So
no, you're right, and I think that's a great point. I'll make sure that I put it in OIDD's inbox this afternoon.
Thank you.
You're welcome.
So there was some other questions besides Lanny. They weren't really questions. It was just comments about how just the climate and asking, you know, a question about gender, you know, it's just really, it's a charged topic right now, especially it's a charged topic right now. And so what would you, Cheryl, do you have any advice for us, for people that live in states that that often receive long essays written on surveys about why our inclusive way of asking this question is wrong. Are there similar experiences in other conservative states? And then Kansas and Georgia gave her a thumbs up. They gave her a +1 and says that what would be useful language we could use that would not make people so angry.
Ooh,
I
I
don't
wish
know
I
that you're going to get
knew.
any language that, because somebody's going to be angry.
Mhm.
You're going to.
Yeah, this is it is, I think, Tedra, you just said it, it's our current climate. It seems that, I mean, we are trying to be respectful and sensitive to everybody. So what would be the best? I think probably putting, as Lanny suggested, gender/sex and leave a blank line. Self-describe or self-identify. Done. That just there. It's one question, but you need to fill in, and then, or I prefer not to say, or do not wish to answer, or whatever you want to do. But is that the most respectful way, or did somebody absolutely have to see their stuff written down, see how they identify written down? Because I think you could have a whole page on this. And I know Craig mentioned survey fatigue. Wow. And then you'll have to do everything. You have to list, you have to be very inclusive. So I don't know. I would ask you guys, do you think people in a conservative state would self-identify if you asked which category, gender, sex, would they fill it out?
Looking here in Georgia, this is Maria. We did get some, let's just say displeasure, right?
Yeah.
And so we have left that space open on many of our forms, on many of our registration documentations that we do for our, like, say, advocacy days. And I was just looking through the registration list for our last series of advocacy days, and people would write, if they chose to write cis female, they wrote cis female, they wrote male, they wrote female. Some people didn't apply. People that were Spanish speaking wrote femeninco, or I'm sorry, whatever the Spanish word is for female. So it was left up to them, and with the exception of a few of them that did not respond at all, it was, they really didn't have a problem entering that data in. But that was our safest way, we felt, to not poke in this charge situation, was to do
So
that.
Maria, what was the whole question open-ended, or did you have male, female, other?
It would say male, female, prefer not to answer, or self-identify. I forget what the phrase was. Yeah. And some people, instead of choosing female, wrote cis female, right? So and instead of us having this long list, right? It's because you're always going to be forgetting someone and leaving someone off. And as we've stated, other is not a preferred category. So
yeah, I wouldn't. Although that is still on your federal form, that's not sensitive, nor is it respectful. So you probably don't want to do that for your citizenry.
I've not ever heard that we got any pushback, but our grantees aggregate their data. Like, we don't actually get the surveys from the participants in our grants. So if the pushback is happening, it's happening in the field, except for, no, we do have council activities that we ask the questions. We sponsor trainings and other events. And I don't know that we've ever, I mean, a lot of people leave it blank because I think they are just like, why do you, like, you see me, you know who I am, but we haven't had a lot of pushback that I know of.
Yeah, and we do have to be respectful about how long our surveys are and how many questions we're asking. I think that's what we really want you guys in some of those final thoughts. Maria mentioned was just really trying to make sure, are you asking questions that, you know, do we need all of this information? Or formatting in a way that helps people answer the question quickly without being overwhelmed by all of the information there. And I do think we have to be, you know, considerate of all of the different learning levels people have, and what kind of information they need to really understand what you're asking them. So that's been some of our conversations with the federal agency, you know, and just making sure, you know, because are they going to, you know, are they going to provide explanations for councils to use? And the answer usually is no. And I'm like, well, then you're going to have 56 different things, and wow. And so, but again, it speaks to whatever you ask is going to be reported. If it's not discreetly male, discreetly female, or female male, then it's going to go into the bucket of other. And then, because right now they're not asking us to determine what makes up, what are all the things that make up other.
And so Cheryl, if someone writes,
Human.
I'm not even gonna, it's just other.
That yeah, that's going to go other. So if people write in, I'm human, you know, that's other. Absolutely. That's a roll up.
Well, I just,
Cheryl,
I wanted
those
to
are-
acknowledge before we go, Janet Fernandez, just saying that, you know, we work towards full inclusion. It's part of our collective value. It, you know, it's part of what we do as a council. Those two words are like actually in the DD Act that funds us. And so, you know, just for us, I think it's an important reminder to air for our work, to make sure it airs on that side of the coin, no matter what we might think about it personally.
That's true.
Yeah,
Janet's wise woman.
Yasmina, I think Yasmina was going to say.
At some point in the discussion, maybe when Cheryl was presenting, there was the discussion of, or a slide that said, you know, you could ask the questions, or you could also do your own synopsis of what you see in the room. What, I don't remember how that was phrased, but.
Yeah, that's the HHS guidelines. So it's on that slide, and they prefer self-identification. They prefer someone who, the person to give you the information, right? But they also recognize that in some instances, an observer, a participant, like an observer of whatever, may be able to provide that information. And so that's something you guys have to weigh on, whether or not that would produce reliable information.
Because when we were talking about some of the groups where there may not be trust,
right?
You know, that may be the easiest way to capture that information at that point in time for that group, until there's a better relationship or something like that. So I just thought I'd mention that because we didn't really discuss it.
Yeah.
The only thing about that you can do that, but you shouldn't assign race to people in your observation. So when you're doing that, you're saying that we had a grantee that was working in the Ukrainian community of the Bronx. I'm just making stuff up, Jackie, excuse me, and You're not saying that these are all, you know, you're not counting 25 white people. You're saying you're not assigning race to them. You're describing who was there and what the, you know, like what their community is and all of that.
Yeah, I think
we should not be looking at people and assigning them, oh, Cheryl's this, Yasmina's that, Maria's that.
Yeah, that can be pretty dicey. I think Nia, and I want to thank Nia Harrison from Virginia. She really brought this topic up back in February, and I just happened to have a call with the diversity committee, and we really appreciate it, Nia, because this is an important topic. But I think one of the bigger challenges and why that participant, like being an observation, was around people self-identifying as having a developmental disability. And so I believe, if you have a training and you ask 10 people in the room, do you have a disability, and all DD or an intellectual disability, and all of them say no, and you can see developmental disability. Can you then identify, although all of them did not answer the question, but your observation of who is in the room indicates, and you could either, I mean, sometimes we just know people have DD, right? We've been working in the field for a while, but they don't believe they do. And I think that's been one of the a challenge for some grantees in getting people to identify as having DD. Is that right, Nia? You have your hand up.
Yeah, I'll jump in. That question, I think, came about because of that grantee that I mentioned in one of my other questions, who was really resistant to asking. They did end up asking, but the results that they were getting were indicating that very few people had a disability. And the whole point of the project, obviously, was to serve people with disabilities. And they were concerned that that would be looked down on by us, by ACL. And we tried to explain that, as long as we can justify it and show good faith effort, that's okay. But they started doing this observational method where they said, even though only 10 people in our community are self-identifying as having a disability, that's a cultural difference. They were serving underserved communities, and they were saying that they could visibly see, particularly people who are older using canes, for example. They were just trying to tag any disability because this was related to the vaccine funding, which didn't have the DD specific requirement. And so we were trying to figure out with them, which set of numbers do we report? And we ended up deciding that we're going to officially report in the performance measures the self-identified information, but in like a narrative, we can add the observational information just to recognize that there's limitations with that. You're only capturing the visible disabilities. You never want to, as you pointed out, identify it for somebody else. It does make me concerned in some ways. So I think just reporting both sets of information might be ideal, but we're kind of just going along and figuring it out as we go.
Cheryl, Jackie had a hand up a while back.
Yes.
Yeah, this is looping back a little bit earlier, but I think what you were saying about like that values of the council is like so important, because I think we get some information that maybe doesn't fit neatly, but like points to potentially other projects. Like I feel like if people are having that much of a backlash about like asking questions, about asking a gender question, it makes me think like, what is the experience of people with disabilities who have that identity? Like when they need to disclose or want to disclose publicly that they are, non-binary or gender non-conforming. I know we had that with one of our grantees, the self-advocacy organization. They actually did, like, they sat down and walked through all the questions, and they said they noticed that some people were kind of laughing when the gender question came up, and they went through the examples or making comments that were, kind of insensitive around the LGBTQ community. And so that made them aware, like, we have some education that we need to do in our network, to build more inclusion or to, build more awareness and understanding of the needs of the LGBT community, or just trying to kind of like push the ball forward around, really normalizing and creating space and showing how it's important, to create the environment where people feel like they can be themselves and share their identity. So that was all that I wanted to add.
Any anybody else before we Cheryl lets us out? The other thing, I will say that we did have a councilman. We had someone that got appointed to the council, and they came to the council orientation, and they did not identify themselves as a person with a developmental disability. And so they had to contact the governor, and they were taken off of our council.
Oh,
Because
interesting.
they had a disability. They acquired it before they were 22. They declined to identify themselves in that manner. So there wasn't really, and they were in a spot. They had been appointed in one of those spots. And so sometimes it's just statutory. So
It is interesting. We have had that in other councils where a person appointed in the self-advocate category would not identify as a person with developmental disabilities, period. And there is no, unless you get, I think our answer back was, well, if that is not the, there's a couple of other categories that you could be a representative for, a local non-governmental or a nonprofit, but if you're not accepting of the category, so person with developmental disabilities, then yeah, there's a choice. It's not one they probably want to make, but it is interesting, no doubt about it. And I know I appreciate you guys' time. I know that we knew questions and answers would be robust, and I appreciate you guys bringing forward all of your information. It's an ongoing discussion. I know that we've got on our calendar June to have another conversation around how we can potentially use our demographic data to really have a meaningful impact on the work that councils do. I think that's a really rich area as well. And I look forward to seeing you guys then. And I want to thank Luz from the DC Council, Jackie from the New York Council, Tedra from Michigan Council, and Maria from the Georgia Council. Thank you guys for being our subject matter experts today.
Thanks so much, everyone. This was great.
it really was great. Looking forward to June. Everybody have a great night.
Bye.
Take care.
Bye.
Bye.
Thank you.